Once upon a time, dying young meant some tragic poet in the 1800s who caught tuberculosis, or someone who joined a war they didn't sign up for emotionally. But today, you don't need a battlefield. The world itself seems to have become one, and the casualties are getting younger. So let's talk about it. Not with panic or pity, but with plain, uncomfortable facts. Why are young people, yes, the generation that eats kale, meditates, and tracks steps, dying too early? No one. The numbers that shouldn't exist. Here's a headline no one wants to read. In 2024, global data showed that mortality among people aged 15 to 39 rose in almost every region. The WHO quietly confirmed that preventable causes now make up the majority of young adult deaths. Road injuries, suicides, substance abuse, and lifestyle diseases. In South Asia, about 13 out of every 1,000 people aged 15 to 39 die before reaching 40. In Europe, it's about 1 to 2 per 1,000, way lower, but still higher than it should be in a world of advanced healthcare. We've basically become the first generation that can live stream our own burnout. No two. Modern lifestyle, the silent serial killer. Let's start with the one culprit that hides behind your phone screen, the lifestyle paradox. We live longer but die earlier, biologically speaking. How's that possible? Because while technology gave us convenience, it also quietly took away our movement, sunlight, and sanity. Our grandparents walked miles for groceries. We, on the other hand, can summon a pizza with 3 taps and eat it while complaining about low energy on a Reddit thread. Studies from Harvard and the CDC show that sedentary living now rivals smoking as a death risk. Sitting for over 8 hours a day without physical activity raises your risk of early death by up to 60%. And yes, that includes you, even if you go to the gym sometimes. Then there's sleep, or the lack of it. The irony? Young people boast about being grind-set warriors, while their brains quietly beg for melatonin. The average 20-something sleeps nearly 2 hours less than the recommended amount. Sleep deprivation raises risks for heart disease, obesity, and depression. Basically a slow-motion self-destruct button. No 3. Mental health, the hidden epidemic. Now let's move from the body to the mind. Mental health is the new pandemic no one wears masks for. According to WHO's 2023 report, suicide is now the 4th leading cause of death among people aged 15 to 29 worldwide. In South Asia, where mental health stigma is still sky-high, numbers are even more alarming. And it's not just depression or anxiety, it's hopelessness. That quiet, creeping thought that nothing really matters anymore. The world promised this generation limitless opportunities, but instead they got inflation, job insecurity, and student debt. They're told to chase dreams, but can't afford rent. They see wars on TV, melting glaciers on Instagram, and somehow are expected to post something positive on TikTok before bed. It's like asking someone to smile while the world is on fire, literally and metaphorically. No 4. The digital pressure cooker. Let's face it, social media is both the therapist and the trauma. Young people scroll through endless highlight reels of everyone else's perfect life, curated success, filtered happiness, gym bodies with motivational captions written by chatbots. The result? Comparison fatigue. A psychological exhaustion caused by constantly feeling less than. Research shows that people who spend more than 3 hours a day on social media are significantly more likely to report symptoms of anxiety and depression. And when depression goes untreated long enough, it doesn't always end in recovery. Sometimes it ends in statistics. Now imagine combining that with cyberbullying, loneliness, unrealistic beauty standards, and political chaos. Congratulations. You've got the perfect recipe for a digital age existential crisis. No 5. Addiction, the polished poison. Not all addictions come in bottles or needles. Some are glowing rectangles that you charge every night. But yes, the old addictions are still there, only more stylish now. Alcohol, vaping, recreational pills, rebranded as lifestyle choices. The truth? Substance-related deaths in young adults have nearly doubled in the past decade in many countries. In the United States, fentanyl alone has become the #1 killer of people under 40. In South America, synthetic drugs mixed with adulterants have created entire ghost generations. Meanwhile, the corporate world packages caffeine overdoses as productivity. You can't walk into a cafe without being hit by a wave of anxiety and espresso. No 6. The health crisis we don't see coming. Remember when heart disease used to be your dad's problem? Well, guess what? It's knocking on your door now. Globally, non-communicable diseases like diabetes, hypertension, and cardiac arrest are rising faster among people under 40 than any other age group. The reason? Diet, stress, and the slow death of routine physical activity. Fast food isn't just convenient, it's addictive by design, chemically optimized to make you crave more salt, sugar, and fat. And while we're at it, let's talk about energy drinks, the modern-day fuel for college students and night shift workers. High caffeine and sugar consumption cause long-term cardiac strain. In Japan, a 2022 study found that young men who regularly consumed more than 2 energy drinks a day had nearly double the risk of cardiac events. Yet nobody stops because, well, I have deadlines, bro. So, who's to blame? It's tempting to point fingers. The government, the system, the economy, boomers. But the truth is messier. It's a collective design flaw, a world that prioritizes productivity over purpose. Public health systems ignore prevention. Workplaces glorify burnout. Social media rewards perfection over honesty. And schools? They teach quadratic equations, but not emotional regulation. If we truly want to stop young people from dying too early, we need to redefine success, not as more money or more followers, but as longer, healthier, meaningful lives. What needs to change? Normalize rest and therapy. Mental health support should be as accessible as Wi-Fi. No shame, no stigma, just healing. Teach emotional resilience in schools, not just algebra and grammar, because anxiety and anger kill faster than grammar mistakes. Create communities, not just connections. Real friendships, neighborhood networks, support circles. They literally prolong life. Reform healthcare and urban planning. Cities should be walkable, breathable, and livable, not just profitable. Redefine ambition. Maybe success isn't buying a penthouse. Maybe it's living long enough to enjoy a sunrise without panic. We often say life is short, but that's not meant to be a prophecy. It's supposed to be a reminder to live wisely, not die early. Young people aren't weak. They're wired differently. More aware, more sensitive, more connected, but also more overwhelmed. They're not a lost generation. They're a suffocating generation, trapped in noise, expectations, and the illusion of control. So maybe it's time we stop telling them to toughen up and start building a world that's worth staying alive for. Because the real tragedy isn't that young people are dying too early. It's that the world they live in keeps giving them fewer reasons to stay.